So just to give you a little background about myself, I do live and work in Columbus, Ohio, which essentially puts me on the very eastern part of the Midwest of the United States. And if you think about the Midwest, Columbus is actually the second largest city in the Midwest, only behind Chicago, believe it or not. Although driving in from the airport yesterday, I'm a little embarrassed to put this picture of our skyline compared to what I see in Manhattan, but we do know how to fill a football stadium. This is a hospital. Nationwide Children's Hospital is actually the largest or second largest children's hospital in the country, depending on who's measuring. It extends over multiple city blocks, multiple research buildings, surgery buildings, clinical buildings. It's actually quite an immense place, and I welcome you to visit anytime. Similar to what Rob and Austin have here, we have our own dedicated center for limb lengthening reconstruction. In fact, I copied many things from Rob and Austin, but it's a fully dedicated team only doing limb reconstruction. We see adults and pediatric patients, so it's very high volume, and we're the only center in our region. It's a multidisciplinary center, which is why the term center is applied to it. We have nurse practitioners, nurses, physical therapists, psychologists, nutritionists, social worker, and child life, all part of our team. They're at every clinic, so the patients come in and have comprehensive care all at one time. Before I came to Ohio, as Rob mentioned, I did live and work in Florida for about 15 years, which is great. Our patients all had swimming pools or had access to swimming pool, which was great for therapy. It was just hard to keep them off the beach and out of the ocean with their fixators. But then I moved to Ohio about 8 years ago, and I realized that there is a mandatory call and response for anyone from Ohio. Is there anyone here from Ohio by any chance? So if you meet anyone from Ohio with a t-shirt on the street in Manhattan, and if you say OH,